We now pause on Nationwide to bring you the daily briefing by the Presidential Task Force on COVID-19.
Good ladies and gentlemen, gentlemen of the press, I say a big good afternoon, and I welcome you to the national briefing for today, Friday, 1st of May 2020. I use this medium to extend our felicitations to all Nigerian workers as we celebrate the year 2020 Labor Day. The nation appreciates your tenacity in driving the economy. Together, we can build a more viable country. I also wish to thank our healthcare workers, the media, security agents, and indeed all workers from different sectors that go out into the storm of COVID-19 every day. We say a big thank you. Your contributions have in no small measure yielded the achievements recorded so far. The atmosphere for this year's celebration, more than anything else, forcefully reminds us of the disruption to our hitherto normal way of life and challenges us not only as workers, but also as citizens, and to leave no stone unturned in our efforts to return to a semblance of normalcy. The reality is that our lives and the way we knew it can never be the same again post-COVID-19. The reality also further challenges the labor movement to carry out research and develop new strategies for workplace operations and identify innovative ways of ensuring that productivity of the labor force remains a key driver to the nation's economic growth. Particularly, the challenges we are currently facing in the health sector on account of COVID-19 should be given the due and adequate attention. This year's labor theme, maintaining safety and security in the workplace, further emphasizes the importance of ensuring that all Nigerian workers are adequately protected to increase their productivity. Similarly, it places on the workers the obligation to take responsibility by adhering to the implementation guidelines that have been developed and circulated, especially in this COVID-19 era. The emphasis on safety has been underscored by the determination of the Presidential Task Force to ensure the provisions of PPEs and related gears for healthcare workers, security personnel, and other essential workers. Ladies and gentlemen, as we approach the commencement of the new phase of our COVID-19 control measures, I implore all of us to individually and collectively prepare and deploy all the necessary requirements of the recommended non-pharmaceutical interventions. We must also commit to making it a success through compliance. In this regard, I wish to commend the Nigerian Employers Consultative Association, NECA, for developing and circulating an adaptation of the implementation guidelines released by the PTF COVID-19. I also urge all business entities as well as trade associations, especially markets and transport unions, to similarly adapt and widely circulate these guidelines. The Presidential Task Force COVID-19 remains committed to containing the spread of the virus in Nigeria and would always be ready continue to provide specific and necessary support to any component of our federating units as an objective of the national response. In line with the above, I wish to inform you that our response to the situation in Kano is producing expected outcomes since testing was ramped up. The State Task Force, in collaboration with our teams, have also expanded contact tracing and isolation. A lot of emphasis is being placed on training of different categories of manpower: medical, nursing, cleaners, etc. Building of capacity for coordination, care management, and supply chain. We are also putting together a structure from the Presidential Task Force to provide support on a full-time basis. The United Nations system, coordinated by the World Health Organization, is also putting together a search team and repurposing 3,000 community informants from the primary health care in Kano State to strengthen the coordination of the COVID-19 at state and local government levels. Although the spike in numbers coming out of Kano is a bit worrisome, global trends show that such indicates the discovery of previously undetected cases and creates greater opportunities for detection, isolation, care, and management. As mentioned earlier, the guidelines for phase 1 of the eased lockdown has been released. We urge all states to adopt them and ensure the creation of awareness and compliance. The Presidential Task Force will be meeting with the security agencies this weekend to fashion out modalities for enforcement. Finally, I've been encouraged by the feedback from Nigerians on the need to deepen research into COVID-19 so that a homegrown cure could be found. Part of the mandate of the Presidential Task Force is to build a strong base for research. I therefore urge our scientists and researchers to come up with their findings and follow the validation protocols. The Minister of Health and the DG, Nigerian Center for Disease Control, will now update you on new developments. I want to thank you for your kind attention and wish you a joyous celebration of the Nigerian Labour Day. Thank you.
Good afternoon, everybody. The Secretary to the Government of the Federation, Honorable Ministers, Directors General and Directors, ladies and gentlemen. I join the Secretary to the Government of the Federation in bringing you all special greetings on this special International Workers' Day, which also marks 64 days since the index case of coronavirus appeared in Nigeria and caused the onset of the COVID-19 pandemic in Nigeria, during which much has changed. The daily course of our lives has been disrupted, and the number of persons affected by the disease has continued to rise. Among countries of the world, we have seen horrendous fatalities, livelihoods destroyed, and economies shut down. This virus has affected all of us, from those struggling to survive to those struggling to return home from abroad, and it has even forced changes right at the heart of governments. We have survived many past epidemics, but COVID-19 has been the most difficult and damaging that nations and healthcare systems have faced in recent times. It hasn't been different for Nigeria. With regard to the COVID-19 infection, only 2 states have not yet reported a case at all. 204 cases were reported in the last 24 hours, Kano being 80, Lagos 45, Gombe 12, Sokoto 9, Bauchi 9, Edo 7, Borno 7, Rivers 6, Ogun 6, Federal Capital Territory 4, Akwa Ibom 4, Bayelsa 4, Kaduna 3, Oyo 2, Delta 2, Nasarawa 2, Ondo 1, Kebbi 1. 12 patients were discharged in the past day, 7 in Lagos, 2 in Ogun, 1 in Akwa Ibom, 1 in Edo, and 1 in Sokoto, bringing the total number of those treated and discharged to 319. These numbers speak for themselves because through 204 cases, new cases are the highest count yet. We now have nearly 1,000 in Lagos and more than about 219 in Kano. We have sadly lost 51 persons, each one painful and difficult to share. On behalf of the government, our prayers go out to their families. We have discharged, as said, 319, a number that we are working to increase daily. So there is hope on coronavirus. We have now activated 18 laboratories nationwide to increase testing capacity and improve case management. Partners and Nigerians, both home and abroad, are volunteering to serve and support our efforts. But the tribute I pay today is to the workers of our healthcare system. Doctors, nurses, lab technicians, scientists, and unsung heroes like cleaners, drivers, clerks, ad hoc staff are the Nigerians in the front line. We know that many offices have been working nearly 7 days a week since the outbreak started. Others, more, have stretched themselves almost to capacity, but are still going strong, showing the Nigerian capacity for resilience and fortitude. I say to you all, Happy Workers' Day, and to their families, thank you. We will do all we can to protect your family and your loved ones. We can support the health workers by following the advisories. Stay home, wear your mask if you must go out, observe hand and respiratory hygiene, and observe social distancing. I also seize the opportunity to call on health workers to continue to follow laid down standard infection prevention and control measures, to protect themselves, and to treat every patient with care and attention. But please do not refuse anyone care. With regard to Kano, a multi-sectoral team of 14 specialists comprising of persons from NCDC, NPHCDA, that's the National Primary Healthcare Development Agency, the Department of Hospital Services, the Department of Family Health, infectious disease specialists from IROA, media, and the special advisor will leave for Kano in the early morning to support that state in all areas of response. The main focus of intervention is on training, and capacity building of state healthcare workforce along the various specialties on a very massive scale. On case management, medical, nursing, and cleaning staff shall be trained or retrained. The National Primary Healthcare Development Agency will engage its extensive Kano State network to drive testing demand at grassroots through community mobilization so that NCDC testing strategy can be realized. We get complaints, unfortunately, about patients who suffer from other ailments not being attended to even in private hospitals or public hospitals in this era of COVID-19, which raises concern for immunization, reproductive, maternal, neonatal, and child health, and routine service coverage. A senior official from the Department of Family Health, from the Ministry of Health, is therefore also on this team to go to Kano to help drive the continuation of essential health care, even at private and public hospitals. We shall do all we can to combat this virus, but we cannot do it alone. I earlier mentioned the several outbreaks we in Nigeria have overcome. We, as a nation, must rally together to show how strong we are to handle coronavirus. Thank you.
The Chair of the Presidential Task Force, Honorable Ministers for Health, ladies and gentlemen of the press, I'd like to join the Secretary of the Federal Government of Nigeria, the Honorable Minister of Health, to really acknowledge and celebrate Nigerian workers all over the country today. When I came into public service 4 years ago, the narrative about the public sector was very bleak. I was told about the people I was going to work with in very uncomplimentary terms. My experience of Nigerian public sector workers has been the complete opposite. Every single day I go to work and meet a set of people that are absolutely committed to their tasks, go way above the call of duty, work till 12 p.m. almost every day, Saturdays, Sundays, especially now as we respond to this outbreak. So today I really celebrate all the health workers, in fact all the workers, whether they're in the security services, the public sector, and across the country, working hard to keep us safe. You're the pride of our nation. We need you to keep pushing. Don't give up. And let's keep at this until we get to the end of this outbreak. So I'll keep my comments for today fairly short, just to celebrate the workers of Nigeria, including, of course, gentlemen and ladies of the press gathered here today on Workers' Day, instead of staying at home with your families. We really appreciate all the work that you're doing on behalf of our country. But I also want to acknowledge a lot of people that have supported the response in many ways. This week, students and staff of a school called the Center for Teaching and Learning Academy in Abuja visited our office with eggs, chicken, a few drinks, and said that this is what they had to offer to the people doing the work on behalf of our country. I'd like to say thank you very much. But also, effort has come from surprising places. The road to the National Reference Center, National Reference Lab in Abuja, a 2-kilometer stretch of road, has been in despair for many years. Over the last 2 weeks, the Ministry of the Federal Capital Territory and the Federal Capital Development Agency, without any nudging, at least none that I know of, has almost completed the rehabilitation of that road, making it safer for workers to go to work every morning and leave the offices at night. My colleagues and staff of the Federal Ministry of Health, National Primary Healthcare Development Agency, National Agency for the Control of AIDS, National Health Insurance Scheme, and all the other parastatals in the health sector that are seconded to NCDC at the moment are scattered around the country responding to this outbreak. I'd like to say thank you very much. Colleagues in the National Petroleum Corporation of Nigeria, NNPC, the Independent Nigerian Electoral Commission, who have offered us their vehicles in many states that are carrying our workers around the country, supporting the response. Colleagues in the Nigerian Air Force that have been carrying us across the country, the Rural Electrification Agency that is right now providing solar power across many treatment centers across the country. Colleagues in the Nigerian Medical Association the Independent Petroleum Producers Group in Nigeria, many other organizations, Association of Public Health Physicians of Nigeria, Nigeria Communications Commission that has slashed our data rates for which we use to make calls and send data across the country, the Society for Public Health Professionals of Nigeria. We thank you very much and all your workers for the sacrifices that you're making. But of course, workers in the private sector are not out of this. They've really been supporting the work from the big corporate Nigeria, the Aliko Dangote Foundation, Nigerian Breweries, Hypo, UBA. But also smaller firms like Yellow Chili, Seaway, 54 Gene that is now deploying its third mobile lab to Kano this weekend. We thank you very much for all the work that you do. Blade Farms, Tropical General Investments, Seaway, the Kakovid Group, GIG Motors. GIG Motors, out of nowhere, offered us 6 buses that take our staff home at night and bring them to work in the morning across our 3 sites. They have not publicized this. They asked me not to publicize it, but I'm breaking their request today. Quietly supporting the response, they bring their drivers to NCDC in the morning, they take staff home in the evening on their own. So I'm really grateful to all of you that have been supporting this response. Many churches and mosques, Islamic communities and Christian communities have been supporting the response in many ways. We thank their communities, their congregations, their workers, their imams, their priests, their pastors across the country. I'll stop here for now. There are many more that have supported the response. We keep track of every single donation that comes to the work that we're doing. We write individually back. We will account for every single egg, every ticket, every naira that comes to support the response. We're grateful to Nigerians. We're stronger together. Have a happy Workers' Day.
Thank you. That sums up the technical briefing. We shall now take the questions. Are we ready?
Yes, sir.
Okay.
Good afternoon, guys. My name is Juliana Taiwo Obaloye. I write for the Sun newspapers. SGF, sir, all my questions are for you today. First question, contractors to federal government agencies said they are being owed. Contractors to federal government agencies said they are being owed because ministries have not released to them first quarter allocation. Lockdown, they are saying their situation is there and they are asking how can the task force help? The second question, as the gradual easing of the lockdown begins on Monday, residents want to know if the task force is thinking of advising the president to reconsider the 7.5 VAT rate to cushion the effect of COVID-19 on private sector businesses. 7.5 VAT. And then the last one. Somebody wants to know how much has been received by the presidential task force from foreign donors. Who keeps the disbursement record? What has been spent and on what? That's it, sir. Thank you, sir.
Good afternoon, everybody. Rachel Abuja from the News Agency of Nigeria. My question is for the chairman and the Minister of Health, but it's more or less is not here. So the Minister of State, sir. So today is Workers' Day. So the News Agency of Nigeria actually went round to hear from the frontline workers, and we realized that what my colleagues were saying about money collected before being treated, like for PPE, is true. And when we spoke to some of the frontline workers, nurses and doctors, some of them are led to be paid 5% of their salary, that there's a shortfall, and they don't have PPEs to work, and they are not being included in the hazard salary, and many more. So I would like to know how the chairman will be addressing this, most especially in the FCT. But our colleague in Lagos found out that people just collect money for PPE before treating Nigerians. My second question is for the NCDC DG. We've expanded in our testing capacity, and the cross still remains sample collection, preparation, and referrals. I would like to know what NCDC will be doing in terms of demand creation. More so, sir, to the Minister of Information, please. Sir, I don't know how we tend to further streamline information that Nigerians get on COVID-19. I'm saying this relating to what the picture we are all seeing from Cross River State, where a commissioner boldly said that Nigerians are being induced to lie that they are COVID positive and giving millions of naira. So I think this is a big confusion as it is now to some Nigerians not believing that there's a thing like this infection. I don't know what we'll further do to address this, sir. Thank you very much.
Mr. Chairman, members of the PTF, my colleagues, good afternoon. My name is Nancy Oyedia Oram from AIT. Mr. Chairman, this question is for you. Now, according to the National Human Rights Commission, they said they have received about 104 complaints of human rights abuse. This is from across the 24 states of the Federation. And about 90% of these human rights violations are from the Nigerian police force, followed by the Nigerian army and from correctional center workers. So it brings me to violations of the journalists who are also on the front line in the fight against COVID-19. There was a case here in the FCT somewhere in Apo where a journalist was beaten up. He was on his way somewhere and he saw a joint task force that were enforcing lockdown. This guy was filming these people molesting a tricycle rider around the Apo axis. And some of these people came to the journalist and asked him what exactly he was doing. He identified himself with his ID card, but that was not enough. They handcuffed this guy with another person, first of all, breaching one of the rules of the NCDC of social distancing. This guy was eventually taken to a magistrate court around, and he was given 3 hours of community service and also a fine of 5,000 naira. So it brings me to my question. As a journalist, your ID card, is it not enough for you to carry out your legitimate duties? And apart from that, also, I also want you to plead with the IGP of police to train some of their police officers, especially those of the lower rank. They seem not to understand what the role of the media is at the moment, even before the lockdown and after the lockdown. And secondly, I think the DG will want to attempt this one. For we as a family in Dark Communication and AIT, we have been facing a lot of stigmatization since the confirmation of Raymond Dokpesi Jr. His status to COVID-19. I've seen a lot of people, even in assignment venues, they kind of segregate. So I really don't know what you have to say about that. Maybe you kind of enlighten Nigerians the difference between social distancing and stigmatization. So I want you to elaborate on that. And finally, sir, there seems to be a consensus among some governors to slash the salaries of workers. And looking at the fact that some of them are in the front line of this COVID-19, and some states are also owing salaries. So I want you to react to this also. Thank you.
The chairman, members of the task force, my colleagues. My name is Amaka Ode. I report for Arise News. And my first question actually is for the Minister of Health. But unfortunately, he stepped out. But I'll just, send this to the Minister of State for Health. Well, yesterday, the Minister of Health told us that he had received an interim report as it concerns the occurrence in Kano State. So I'm sure 24 hours is enough time for you to at least have a bit of information concerning that report that you've seen and studied it. So we want to know really what is happening in Kano, and this death that has been recorded, is it somehow related to COVID-19? Nigerians are really anxious and they want answers, really, because every day we see the numbers keep going up in Kano, so we want to be able to marry the facts together. And my next question is for the Minister of Information and Culture. Well, Rachel had spoken about, what we need to do to enlighten people more that COVID-19 is real. My concern really is about the armed forces, those at the front line of the battle against Boko Haram. What are we doing to inform them about COVID-19? I ask this because recently we've seen a lot of movement, especially in the north, where we're seeing Al-Majris being moved together, and some of them have even tested positive in the states that, they've got into. So what are we doing to inform them of the fight other than Boko Haram that Nigeria and the whole world is really dealing with at the moment? And finally, my last question is for the DG of the NCDC. Well, so yesterday you told us that nationwide we have about 3,500 bed capacity in our isolation centers all across the country. And you were appealing, really to everyone to help in the fight against this virus and, donate even their space. But we want to know, this 3,500 that we have, what states are lagging behind in terms of upscaling the bed space? Because we're seeing these numbers, almost every state in the country now has recorded one case or another. So what states in particular do we need help in terms of upscaling our bed capacity in isolation centers, so that way private business owners, even hotels, can come in and help out? Thank you.
Good evening, the SGF, honorable ministers, and my colleagues. My name is Rahila Lassa. I report for Voice of Nigeria. My question is for the SGF. So many NGOs are springing up with the sole aim of fighting COVID-19. There is one in particular, Stamp Out COVID, which suggests that checkpoints should also serve as testing points for the coronavirus. Is government considering working with them along that line? Secondly, I want to draw you back a bit. Yesterday, I asked a question, and it says a good number of senior civil servants working in Abuja live in either Suleja or Kefi. With the ban on interstate travels, what is their fate? Many of them do not have vehicles of their own, and others do not work with organizations that have staff buses to convey them to and fro. Thank you.
The chairman and members of the Presidential Task Force and Nigerians at home. My name is Mitaire Ikwen of the NTA. I want to ask the chairman of the Presidential Task Force. Testing 2 million people in 3 months will definitely lead to increase of confirmed cases. And if we begin to have more confirmed cases and the situation gets out of hand, are we going to revert to a lockdown? Then as a follow-up to one of the questions asked by my colleague on Kanu for the DG NCDC, you said verbal autopsies are ongoing. What are your findings from these verbal autopsies about the situation of mysterious deaths in Kanu? And finally, concerning the curfew. The curfew from 8 p.m. to 6 a.m. We know that a lot of, in Lagos and Abuja, for example, a lot of Nigerians live in the suburbs. They live outside the city center. Most of them wake up 4 a.m. to try to beat the traffic and come to town. But with the curfew time from 8 p.m. to 6 a.m., are the security agencies prepared for the kind of gridlock that could arise from everybody hitting the road by 6 a.m.? Those are my questions. Thank you.
Good evening, SGF, ministers, and my colleagues. My question goes to the Minister, Second Minister, Education. Ajụjụ m ga-abụ n'Igbo. Ihe nnachi jụụ na aka na-achị steeti Anambra kọwara na n'ụbọchị Mọnde n'ụlọ akwụkwọ praịmarị na nke sekọndịrị ga-amalite ịgụ akwụkwọ. Ajụjụ m na-ajụ wee bụrụ, kedu ihe ga-abụ okwukwe maọbụ echiche ebe ndị ọzọ, steeti ndị ọzọ nke a na-agwabe ka ha malite ịgụ akwụkwọ? Iche ha na ọ ga-abụ ihe mwute nye ha na ndị ọzọ ga-aka wee mụta ihe karịa ha nwa ndị nọ n'ụlọ na-enweghị ụlọ akwụkwọ ha na-aga. Thank you.
Speak English, please, so that I can interpret.
Okay, my question is, Anambra State Governor has said that by Monday, primary schools and secondary schools should resume and workers should start going to work. What will be the fate of those who the state have not declared that the schools and the workers should start going to work? Won't it leave a psychological effect on them? Thank you.
Good evening. My name is Friday Okerigbe. I'm a reporter with Channels TV. I'd like to direct my first set of questions to the WHO country rep. My first question has to do with the numbers of vaccines and treatments that have been undergoing clinical trials. What information do you have? Do you have any vaccine or any treatment in the offing as we speak? The second question also to the country rep, I would like you to take us through what is the process of certifying a drug or a vaccine and approving it by WHO for treatment. I'm asking this question because in the past, we've seen a lot of efforts by Africans. In the days of Ebola in this country, the then Minister of Health confirmed that some treatments that we use were actually produced in Nigeria. Even though they were very effective in curing Ebola, up to now, none of them have been certified by WHO. So what is the process? The second question, I would like to direct it to either the Minister of Health or the DG NCDC. How many contacts are we actually tracing as we speak today? Because some time ago you told us the number of contacts we were tracing in Lagos and Abuja when the peak was in Lagos and Abuja. Now we have Kano. How many contacts are you tracing? I also like you to respond to this actually from a viewer who said that I should help him ask. Is it possible, or are you considering setting up some sample collection centers in the markets now that we'll be resuming some of the markets as from Monday, especially in cities like Lagos, FCT, and Kano? Are you considering opening some sample collection centers in some of these markets? Thank you.
Thank you very much. That wraps up the questions coming in. We have the questions directed at the Honorable Minister of Health. The Minister of State will take his questions. The Director General NCDC, followed by the WHO representative. After that group, the Honorable Minister of Information and Culture will take the podium before the Secretary to Government and Chairman PTF wraps it up. We'll begin with the Honorable Minister of State for Health.
Thank you very much, Mr. Chairman and my colleagues on the team, the PTF team and respected House, the journalists here present. Let me join my colleagues in saying congratulations to the Labour, NLC in particular, and then of course the entire workforce, as today marks the Workers' Day. I want to salute all workers in this country and in particular and the entire world in general for their sacrifice and labor of love. The questions for me, I think the first one came from Rachel. That's a Voice of Nigeria. News agency, I'm sorry, okay. Sorry for that mix-up. News Agency of Nigeria, NAN, yeah. And it has to do with allegation, I will say, that in some hospitals, patients are being asked to bring PPEs before treatment. If that happens at all, that is a strange demand. And without mincing words, I will say that's illegal, it's unacceptable, and of course condemnable. I do not expect any treatment center or hospital or any clinic to be making such demands from patients. But be that as it may, we will definitely seek additional information in this regard with a view to enabling us do appropriate investigation and of course take appropriate remedial actions in this regard. I think it's bad enough for a patient to come to the hospital and you compound the problem by making demands that are not within the ambit of what is expected. So we will look into that, and we hope that your good selves will also assist us in terms of giving us information, because we need information to work on. That is not to say that we will not put in place our own machinery as well, in order to know who exactly these culprits are. Having said that, we will also want to know whether this is taking place in tertiary hospitals or the federal government-owned institutions or the state. And if it's irrespective of where this is happening, whether at the state institutions or at the federal level, we will definitely want to seek intervention and do what is appropriate in the circumstance. I think the next question is from, I think, Amaka Arise. I hope I got that right this time around. Essentially, you will want to know what the situation is in Kano, having said at this forum, I think a day or two ago, that we have a team in Kano. Yes, that's exactly what I'm going to address. Yes, we did have an interim report in place after the team has been dispatched to Kano. And what that interim report contains essentially, and that has been made available to the PTF, essentially is to let us know the level of engagement, because that's the first thing to do. Engagement with the state government in terms of the governor himself, and of course the state team that is in charge of COVID-19 response in the state. That's the first level of engagement. Then engagement with the various segments of the Kano state. You're talking of the faith-based organizations, the civil society groups, community leaders, and every other group that is in Kano, because when we talk about the approach to managing COVID-19, we talk of all of society and all of government approach. So you need everybody to come on board. So this engagement took place already, and that gave opportunity to have information that will be required in order to unravel the totality of what happened in Kano, even beyond COVID-19, where that is the case. So that's the first thing that has been done. And I can also tell you that in addition to this, as at this point in time, we have assembled appropriate resources. That is, human health resources. We have assembled those that will also help to build capacity in Kano. And of course, you recall that at the point in time, the lab in Kano was shut down. But this lab has been reopened now because the proper things that were to be done had been done in terms of biosafety, biosecurity, and of course in terms of having the right personnel to handle the lab. So it's functioning now. You recall that for a few days you were not having a report in terms of the lab in Kano. And part of the things done already is the verbal autopsy that one of your colleagues mentioned. And of course, there is need for strengthening the entire structures on ground, whether in terms of surveillance, in terms of contact tracing, in terms of the facilities, be it isolation centers, and of course, treatment centers in the entire place. Of course, the PPEs have been deployed and ambulances as well to Kano as we speak, and other consumables are needed. So these are some of the things that have been put in place, and the PTF is going to set up a kind of independent secretariat in Kano, but I will work with the state government in order to unravel whatever that needs to be unraveled in terms of particularly the number of deaths that had gone up astronomically. And of course, we also have the necessary support in terms of personnel to make all this possible. So it's ongoing in terms of, we're not stopping. And of course, I can also tell you that the PTF as a body will have visited Kano by yesterday, but for the demise of the father of the coordinator, the national coordinator of PTF. So that is the situation for now in Kano in terms of what the Dara report says. Of course, maybe just to add that you have immediate measures, as have been mentioned. You also have medium and long-term measures to be put in place. I think the final question is from Friday Channels. I hope I got that right as well. Friday, well, essentially, I think it's about the number of contacts being traced. I know the NCDC will give you that details. But let me just say that it's difficult, even at this point in time, to start reading out figures in terms of contacts at this point in time. Because when you have a situation that you are dealing with community transmission, it's extremely difficult to have contacts tracing that is accurate. But be that as it may, I think the DG of NCDC will give you the full details if that is available. Thank you.
Sorry, you did not say anything about the salaries we have to
About? Oh, okay. Yes, that is not true. Everyone that is in the system, there are three categories. The category of doctors, dentists, the category of pharmacists, medical laboratory scientists, and others in that group. And the third category, they are cleaners, ward mates, attendants, and of course, some others who are not necessarily health workers, but they are working in the environment that is potentially hazardous. So they have all been captured. So everybody is captured, and you will recall that I think sometimes last week or early this week, I did explain that it's been taken through the whole gamut of federal civil service structure. So these are things that are on ground already. But when you talk of the hazard allowance, it's not just the health workers alone, but people who are working in a potentially hazardous environment have been captured. I did mention all that. So they are captured. And this is within that civil service structure. And I did say then that the Minister of Labor and Employment was part of the whole deal, and all the workers through their various representatives, be it pharmacists, be it doctors, be it medical lab scientists, and all the unions, 37 unions represented by Johesu, they were all captured. So no one is really left out. And not just in terms of incentives given to them, but in terms of insurance. And the volunteers who are not captured within the framework of federal civil service, they are captured by donated insurance packages from those who have been helping us as donors. Thank you.
So thank you very much. Just a few questions. There was a question on sample collection and on the demand side. Right now, yesterday we tested 2,000 samples. So that's the highest number of samples we've tested in a single day across the country. And these numbers have been increasing every day. So despite the challenges in parts of the country, the truth is samples are coming into our laboratory network across the entire network. So there's a lot of effort being made by healthcare workers, despite some challenges here and there. In terms of, I think there was a good question on stigmatization and the balance between social distancing and stigmatization. We've said this severally in this press conference. It's really unfortunate. Imagine if that's happening in Abuja, what would be happening across the country for homes or communities where individuals have been affected or infected. So we really encourage all Nigerians. You know, we're in the beginning of a journey. And the most likely scenario is that until we have a vaccine, we will have to learn to live with COVID-19 in our country. So if we start stigmatizing each other, I don't know where it'll stop, because the same people that are stigmatizing one group will end up being infected themselves tomorrow. So really, we have to tell ourselves the truth about this and encourage each other that this is really, there's no point, because all of us here are just as vulnerable to catching the infection as many other people. We do our best, but we always have to remember it's a virus. You can't build a wall, so anything can still happen despite our best efforts. In terms of bed spaces, we have about, from the information we receive from the states, because every day we ask the states, how many beds do you have ready? So from the information they feed back to us, we have about 3,500 beds available right now. And every state we push them to make more beds available. We have a breakdown of those, but I don't have it here to share. So that's really where we are. So we encourage every private sector partner, if you want to support a state, please do so in the state where you're living. Where you're working or where you think you want to support. So there's no state in Nigeria, even Lagos, even FCT, that has fully fulfilled the bed capacity that they need to respond to this outbreak. No single state in Nigeria has achieved that. the investigations in Kano are ongoing. They're led by the Kano state government. So whenever they're ready, we'll release them. But these things are not easy. I've made an analogy previously to a crime scene investigation. It takes a while, so we will share those results as soon as we have them. But the key thing is, are these results supporting the response in Kano State right now? And yes, they are. In terms of the number of contacts, like the Honorable Minister of State for Health said, it's a very fluid number because every day there are new cases, and with every new case there are new contacts. But we're following up cumulatively about 12,000 contacts across the country from the beginning of the outbreak. And the final question on, are you considering sample collection in the markets? Like we said, we are driven by the evidence. So if we see that there's increasing transmission in a market setting, we will go to that market. But we're not going to set up stands in every market across Nigeria to collect samples. So we look at the data, we use the data every day to make decisions. And if we have to go into markets or a specific market, we'll do exactly that. So thank you very much. Have a happy Workers' Day finally.
The Chair of the Presidential Task Force, honorable members of the task force, ladies and gentlemen, I also would like to salute all workers on this important day, World Labour Day, and in particular, health workers who are working tirelessly around the clock to keep us all safe. Your efforts are well appreciated. On the subject of vaccines and clinical trials for COVID, I'd like to say that research and development is an important aspect of the response, and researchers around the world are working hard on accelerating the development of vaccines and therapeutics for COVID-19. WHO has launched various working groups to accelerate various aspects of vaccine development. A call was made by 130 scientists, funders, and manufacturers to help speed the availability of a vaccine for COVID-19. And together with global health actors and partners, over the past week, WHO launched the Access to COVID-19 Tools, ACT, Accelerator, a global collaboration to accelerate development, production, and equitable access to new COVID-19 diagnostics, therapeutics, and vaccines. We have a total of 89 vaccines that are in development globally, including 7 in clinical evaluation, and several therapeutics are in clinical trials. WHO is committed to ensuring that as medicines and vaccines are developed, they are shared equitably with all countries and people. We do have the Solidarity Trial that some of you may have heard about. It's an international clinical trial to help find an effective treatment for COVID-19, launched by the WHO and partners. More than 100 countries have joined the Solidarity Trial, and to date, over 1,200 patients have been randomized from the first 5 countries to evaluate the safety and efficacy of 4 drugs and drug combinations. Nigeria has also expressed interest to be part of this Solidarity Trial, and efforts are underway to start the process in Nigeria. The process itself for certification of vaccines is a very rigorous and thorough process, because we aim to ensure that products that are approved for use meet safety requirements. Once a product is submitted to WHO for review, there is a detailed process for pre-qualification that includes review of all the data on the clinical trials that are expected, and that this data should meet the global safety standards. We work with national regulatory authorities on assessments, licensure, and post-marketing surveillance. All this is important before a vaccine is actually approved. So just to conclude, to date, we do not yet have a vaccine. The trials are underway in a very accelerated process. It usually takes years to produce a vaccine, but the emergency process currently ongoing is really aiming to get a vaccine out as soon as possible for protection of people. Thank you.
Thank you. We'll take the Honorable Minister of Information and Culture.
Mr. Chairman and members of the PTF COVID-19, gentlemen of the press, permit me to join all those who have spoken before me to felicitate with the Nigerian Labour Congress on the May Day celebrations, and also the opportunity to express our appreciation to the organized labor for the support the government and the committee in particular has received from them in the fight against COVID-19. There are two questions which were addressed to me, three actually. The first actually is why people are not taking the COVID-19 pandemic as seriously as they ought to. But the truth of the matter is that COVID-19 is real. And it's about, the issue is about life and death. And we at the PTF will continue to take this matter very seriously. I don't believe that any reasonable person actually would trivialize the issue of COVID-19. And if they do, that will be a very serious mistake on their part. And we will continue on our own part as PTF to address these issues. We've been doing a lot at the level of the PTF to keep Nigerians informed through the various jingles, television commercials, the social media, etc., about the pandemic. Even this daily national briefing is part of our efforts to keep Nigerians informed. We'll continue to improve on this in the days ahead. We're rolling out new jingles and TVCs on such issues as stigmatization and the need to have personal protective measures, such as, wearing of face masks. But I want to remind you that the NOI poll showed that 99% Nigerians are aware of COVID-19. So the problem is not that of awareness, but perhaps that of mischief on the part of some people, which is quite regrettable. The PTF is not relying just on jingles, sensitizations, and TVCs, but it's also embarking on community relationship, because we believe that if the community does not take possession or ownership of COVID-19, our efforts might not be as successful. And the PTF devoted quite a substantial of its meeting on how to help. And working with our partners, the NCDC and the Ministry of Health, we have resolved to revive the over 3,000 operatives in Kano State alone, who were used when the fight against polio and to a lesser extent, Lassa fever, became problematic. No, these are the foot soldiers who work within the community, who the community, trusts, and who was also asked as scouts for the PTF and the NCDC to identify, houses where we need to, address the issue of, testing. They also work, very effectively to help us to trace contacts. These are part of the decisions that were arrived at this morning at the PTF, meeting. On the issue of the military, I'm happy to say that the military is not only fully aware of COVID-19, they are doing a lot to support the fight against the pandemic. I'm sure on several occasions there, the ministers of health, the DG, NCDC, the chairman, we have all expressed individually the role that the military have been playing in the fight against COVID-19. But for them, we would not have been able to achieve what we've achieved so far, either in terms of delivering logistics or, getting our staff around. But in addition, the military, they've also made, life-saving equipment, and they've also provided, transportation logistics for the PTF. There's no doubt that they are also keeping their personnel at the war front against Boko Haram fully informed. The military is, as you know, is one of the most dynamic national institutions that we have. And the safety and security of the military personnel who are daily making great sacrifices to keep all of us safe is always a priority. As you know, we also, at the PTF, we meet regularly with the entire, security, heads. And as a matter of fact, we'll be meeting again tomorrow. And we have been assured that these meetings have been taken not just by the military, but the police and other security agencies to ensure that the pandemic is contained. The third question, which I'm sure the SGF will also, explain further on, is the issue of the media and the harassment of the media. I think we've made it clear that a valid identity card of any media organization is enough proof that the holder has a right to move freely. If there are cases of, excesses from the security agencies, well, I can assure you this matter will be taken up at the highest level. Like I said, we'll be meeting with the security forces tomorrow again, and we are going to escalate this matter. Thank you very much.
Thank you. We shall now take the SGF and Essential Task Force.
The first question was, I think, regarding contractors not being paid. That was directed at me. Well, I know that at the beginning of the year, in the first quarter, the Ministry of Finance released about 280 billion naira to the different ministries and agencies as part of the releases for the first quarter from the 2020 budget. I believe some contractors have been paid, not all. And as we progress in the application of the budget, though now really disrupted, people will continue to receive their monies for legitimate businesses that they have executed on behalf of the government. That is as much as I can say about that. The issue of VAT, whether government should consider suspending VAT. If you recall in my statement, when I spoke about the need to ease up the lockdown so that businesses can come on stream, part of what I spoke about was to allow trade, taxation, and the other things. Because government must derive revenue to be able to meet even overheads of its management and personnel costs. We have been dependent on oil, and we can see the disruption that has happened with regards to our earnings in the oil and gas sector. The benchmark we had for the budget has totally been distorted. Now what we have is determined by market forces. How we sell, what quantity we sell is totally beyond us. So there is a major decline in government revenue. VAT is a component of government revenue. Taxes, either income tax or company tax, are all parts of government revenue. The increase from 5% to 7.5% was just brought into application in February of 2020, all in an attempt to ramp up resources to meet our 2020 budget and into the future. Let me explain even the sharing formula for VAT. Of whatever is earned through the value-added tax, only 15% goes to the federal government. 85% is shared between the states and the local governments. So if you reduce VAT and couple with a decrease of income that comes into the consolidated revenue fund of the Federation, where states at the end of the month gather to share through the Federation account allocation meeting, there will be crisis. I can tell you there will be crisis. So whatever we need to do in terms of rigorous and elaborate and extensive collection of revenue, we must do that to be able to compensate for the losses that are coming in as a result of the downturn in our earnings with regards to the oil and gas. So, and mostly, VAT is always on luxury items. Most of the essential items are VAT exempted, like drugs, sanitary things. Basic consumables are exempted from VAT. VAT is always related to luxurious consumptions. So I think as much as possible, I'm not sure I would want to advise at this stage for us to consider a reduction in the 7.5% VAT, because that will really eat into the earnings of the states and the local governments. Somebody alluded to the fact that salaries are not even being paid. So a major reduction with regards to our sources of earning will further deepen that crisis. So I think we must find a balance now to try as much as possible to maintain some bit of economic and physical stability in the system so that we do not jeopardize the interests and the earnings of our people. Somebody asked about how much has been collected and expended by the Presidential Task Force. Let me make this very, very clear, that the Presidential Task Force is not a revenue or a donation collection agency. The Accountant General has opened 2 accounts in the central bank and 5 in the commercial banks for the purposes of our national response to the COVID-19 pandemic. Private donors, like different organizations, charitable organizations, individuals, have been advised to pay these monies directly into those 5 accounts in the different commercial banks. And it is the responsibility of the Accountant General on a daily basis to mop those amounts of money and transfer them to the central bank accounts for the purposes of administration. The Presidential Task Force is built up in such a way that it is multi-sectoral. That's why you see this number of ministers with different responsibilities. We have a budget that we have submitted. When the monies are made available, and some part of it have been made available to the different ministries for the purposes of execution of the part of the mandate of the Presidential Task Force that falls under their responsibilities. At the appropriate moment, we will render accounts. So the Presidential Task Force is not a contract awarding institution. The instruments of every ministry will be used for the purposes of the procurement. Ours is coordination and general supervision. So when you hear that the COVID have raised 21 billion, please, the 21 billion does not come to the Presidential Task Force. Or you hear NMPC and its partners have raised 21 billion. The 21 billion does not come to the Presidential Task Force. Or you hear the European Union making a contribution of 50 million euros. It does not come in cash to the Presidential Task Force. All these contributions are specific project identified commitments. Some have taken upon themselves to build isolation centers. Some are procuring vehicles. Some are procuring the ventilators and different consumables, PPEs, masks, and different other items. But I can assure you, we are responsible people, and we will be responsible with whatever is committed into our hands. At the appropriate moment, we will render accounts from time to time as to how we are faring. But for now, I'm not sure anybody has awarded any contract. Nobody has received any money, except probably for agencies of governments that have been involved even before the setting up of the Presidential Task Force. You will realize that this response started even before the Presidential Task Force came on board. There was a question about 104 human rights abuses, and mostly with the police, army, and the National Correctional Force. This was asked by AIT. We have established a protocol with the Human Rights Commission. We've advised them that if there are cases of infraction of human rights, draw their attention and file the report to the appropriate agency for necessary action before you can confirm either the authenticity of the complaint that has been laid, or you confirm the veracity of the story. And we've done that. And you can see by certain actions that have been taken, particularly by the Nigerian police, in terms of discipline, where an officer or an inspector with another one were dismissed from the force as a result of the establishment of an abuse on a woman somewhere, I think it's either Ondo or Ogun, and similarly in other places. Actions are being taken. But the reports must first be filed so that the agency would have the responsibility through their own processes that have been established by law to either court-martial them or to do a guardroom trial or whatever it is. But there are processes, and I can assure you that Mr. President is very concerned about any element of human rights abuse, and as long as we remain as a task force, we would ensure these issues are investigated and dealt with appropriately. The fifth question here is about state salaries being slashed. Well, to a large extent, I would disqualify myself from making any comments on that. I'm incompetent. I don't run a subnational government. I don't know what must have informed those decisions. I can speak authoritatively for the federal government. Nobody's salary has been slashed. Out of our own volition, the members of the Federal Executive Council donated 50% of their salary willingly. So that is as much as that is concerned. I think those questions can be better directed at the state governors who have taken those decisions. But I think those decisions might have been taken in conjunction with the people of the state. These are very, very difficult times that require very drastic solutions. So that could have been what informed those decisions in the state. Civil servants working or living in Suleja and working in Abuja. We acknowledge that as a challenge. If you see the protocol that we released, we were even mindful about intrastate movement. We mentioned there that we discourage movement across local governments, but we acknowledge the fact that in metropolitan areas like Lagos and Abuja, if you restrict movement across local governments, it will hinder a lot of work. Because like in Lagos, virtually all the local governments are consigned within one city. If you say you are going to restrict those kind of intrastate movements, it will damage what you want to achieve. So I believe Abuja particularly and Lagos will be looking at the issues of border or interstate movement. Because I acknowledge the fact that substantially most of the people that work in the civil service and even in the private organizations in Abuja, a lot of them live in Suleja. Some live in Karu, on the part of Nasarawa State, not the Karu of Abuja. So that would be a major challenge, but we will draw the attention of these entities, FCT and Lagos, to look at how they can work out that. The president was very, very clear in his mind when he advised that these are the guidelines, but states can modify them to suit their peculiarities, but to remain within the framework of the desired objective that we want to achieve. The other question is what happens if there is a spike in the numbers? Well, that's a very difficult question. Experiences from other nations that have eased up the lockdown, there have been spikes. Even our sister country, very close by, Ghana, 10 days after the lockdown, the figures just went up. Germany had that experience. Several other countries have experienced that. And everybody is navigating the rough road, trying to find a solution to it. Part of what I see them do is that they try as much as possible, in spite of the spike, to ensure very strict compliance. Because sometimes, if we can be disciplined enough, compliance does not become a major problem. Sweden, there's no lockdown, there's no use of mask, but compliance has been part of their culture. But we have a challenge with that. If we can just get our people to understand that this is a collective responsibility, that we must work together to ensure that these directives and guidelines are meant for our good, I think we will be able to cross that particular Rubicon. Anambra, I understand what happened in Anambra is that the governor said teachers will return on Monday, but students will remain at home and continue with e-learning. That is the position of Anambra to the best of my knowledge. I stand to be contradicted, I stand to be corrected on that. He did not say that schools will resume. No, teachers will report as other civil servants are reporting, but students will remain at home and apply themselves through the e-learning process. And I believe if we do that, in most places, we will be able to get a better understanding of the situation and move forward. As I conclude, just a quick reminder of where we are. On the 30th of January, when the WHO declared COVID-19 as a major health challenge of international concern, we had 7,818 infections globally. 7,818 infections globally, out of which 7,736 were in China. Only 82 were outside China. By today is 3 months. Only 82 were out of China. And these 82 were in 18 countries. As of yesterday, 30th of April, 2020, 3 months after, the record globally is about 3.3 million infections, with 213 countries and territories with infections. I'm painting this picture so that we appreciate the magnitude of the problem we are dealing with. Within a period of 3 months, with just 82 infections, we are now at 3.3 million and in 213 countries of the world recording infections. Going forward, as a country and as a people, we must challenge ourselves that we will do everything humanly possible to ensure that we apply ourselves, in spite of the inconveniences, to do what is needful to reduce the level of our infection, flatten the curve, and begin to see a decrease on the expansion. As of today, we have only just 2 states, I think, Chukwe, that have not reported. Just 2 states that have not reported. So it means that if we are not helped in the next, I'm not praying, but if the spread and the picture I see internationally is what would apply here in Nigeria, then we must be prepared. I will remind us again and again that the time for personal responsibility is now. And we better own up to this, that we have a part to play as individuals and collectively as a people to ensure that we do everything to flatten the curve and begin to see a decrease in the levels of infection. Thank you. I wish you. What is that? Well, I think that's an advice that I will leave for the Ministry of Health and the Nigerian Center for Disease Control, being experts, to look at the prospects and the possibilities of conducting checks at checkpoints, so that in the process of wanting to do that, you do not build the kind of traffic that will completely defeat the essence of social distancing and all other adversaries that we have sent out there. So it must be a balance. It must be a balance. It must be a balance. Thank you.
Thank you very much, SGF. That brings us to the end of today's national briefing. We must thank our partners, as always. We must thank the organized labor for teaming up with us. We must thank the media partners that have been broadcasting into the homes of Nigerians. Of course, our partners, the NAPTIP and site savers, the environmental health officers, and all of those that have contributed in one way or the other to this, bringing these events to you. We say thank you. But a number of messages have come out, judging from some of the questions and the responses. One is that COVID-19 is real. It is indeed not a joke. 3.3 million cases in 3 months shows that it is not a joke and that it is a matter of life and death. Please take responsibility, play your part, and keep the numbers low. Well, in the mood of celebration with our workers, we say thank you. We thank our healthcare workers, the media, security agents, and indeed all workers from different sectors that go out into the storm of COVID-19 every day. They take the risks. We say thank you to you. You are the pride of our nation. Don't give up. Finally, we as a nation must rally together to show how strong we are. Together we shall overcome. I thank you very much for being with us. God bless Nigeria. We'll see you on Monday.
That's